And thank you for joining the Rhode Island Business Group on Health for our session this morning. Before we get started, we'd like to thank our event sponsors, sponsors for the Crush COVID Employer Challenge, the Rhode Island Department of Health, and the Rhode Island Foundation. I'd also like to thank our annual sponsors. Could change the slide, please. Our platinum sponsor, Mercer, our gold sponsors, Aetna, Blue Cross and Blue Shield of Rhode Island, Neighborhood Health Plan, United Healthcare, HILB of New England, and Tufts Health Plan, their name to be changed soon, and our silver sponsors, Merck, Novo Nordisk, USI, and Delta Dental. We'd also like to make you aware of our upcoming programs. First, we'll be holding our annual golf tournament on August 9th at the Wannamoisa Country Club in Rumford, Rhode Island. This is always a popular event on one of the nicest golf courses in New England. We've ordered up great weather and hope you will join us. Next, we have an event scheduled on September 29th, which is being held in conjunction with World Heart Day. More to come on that, more to follow on that event. Finally, we are excited to announce that we'll be holding our annual healthcare summit in person. I repeat, in person at the Providence Marriott on November 19th. Please be sure to mark the date. That's November 19th. As a reminder, be sure to follow us on Twitter at the RIBGH, one word, and tag us using hashtag RIBGH Healthcare. We are excited to bring our members and the community together to celebrate the award winners of the Crush COVID Employer Challenge. I will now turn the program over to Kate Kennedy, Vice President of Employee Benefits with USI Insurance Services, RIBGH board member and member of the RIBGH H&P Committee, who will act as the host for today's program. Kate?
Thank you, Al. So good morning, everyone, and welcome. We're very excited to bring everyone together this morning. I was saying just before we started that certainly we would prefer to be in person, but as we're emerging from the pandemic, this is the next best thing. So it's so great to see so many familiar faces and so many new ones as well. So just to review our agenda, our keynote speaker, the Department of Health COVID Unit Medical Director, Dr. Jim McDonald, will share remarks on the role of employers in the COVID vaccine rollout. We will then have an interactive breakout session to allow you the opportunity to connect with one another and discuss best practices around employers' role with vaccine and ongoing health and safety practices as offices look to reopen. Our awards presentation will come next, followed by a second breakout session where our Crush COVID Employer Challenge winners will share highlights of their experiences, including efforts around promoting disease prevention and choosing wisely in their organizations. So at this time, before I introduce this morning's speaker, again, a couple of housekeeping items, as I mentioned, if you wouldn't mind keeping yourselves on mute. We do encourage you to submit questions to Dr. McDonald by entering them into the chat feature. And some of you also had shared questions when you registered for the event, so I do have those handy as well. At the end of Dr. McDonald's presentation, I'll share a select number of questions for a Q&A. And with that, it is my great pleasure to introduce Dr. McDonald. So Dr. McDonald has served at the Rhode Island Department of Health since 2012 as the Chief Administrative Officer of the Board of Medical Licensure and Discipline. He's also the Medical Director for the COVID Unit, as well as the Center for Customer Services and the Drug Overdose Prevention Program. He is also a member of the Governor's Task Force on Preventing Overdose Deaths. Dr. McDonald earned his MD from Loyola Stitch School of Medicine in Chicago, his pediatric residency in the U.S. Navy, and his preventive medicine residency from the State University of New York. He earned his MPH from the University of North Carolina in Chapel Hill. Dr. McDonald is board certified in pediatrics as well as preventive medicine. His diverse career includes officership in the U.S. Navy, as well as private practice in rural areas and in the Navajo Nation. Dr. McDonald lives in North Kingstown with his wife, 3 children, and 2 dogs, Rosebud and Daisy. Dr. McDonald, I turn the floor over to you.
Yeah, thank you, Kate. And it's great to be meeting every year this morning and good to join you from my dining room. So Rosebud and Daisy are afoot throughout the house this morning. Sarah brought them to the basement, but if you hear a random bark, that's just Daisy and Rosebud being Daisy and Rosebud. So good for us, right? So it's fun to hang out with you this morning. And what I prepared a few slides because I just have a story to tell you, and then I want to answer your questions. And so I'm going to share the screen, and I'm always a bit amazed when I actually can share the screen successfully, because to me, it's like modern technology just amazes me in so many ways. But one of the things about the pandemic, before this started, I didn't know what Zoom was. I learned what Zoom was like one of the first Fridays of the pandemic when I hit buttons and all of a sudden joined my first Zoom meeting. And I don't know how I could live without it now. So it's fun. So let's walk through some stories here. One of the things I do want to tell you, if you do listen to podcasts, Dr. Chan and I have a podcast called Public Health Out Loud. And it's about half an hour. We do a weekly episode on various public health topics for the public. If you're interested, it's at health.ri.gov/podcast. Feel free to share this with your own folks if you're interested. But it's a nice way for us just to talk about public health concepts, which I think we'd all agree. There's just too little public health conversations going on because quite frankly, we hear a lot about a lot of things, but you really don't hear a lot about just public health for the average day person. And I'll just start with this. Like, I don't know what you were doing on November 17th, 2019. My guess is you don't know what you were doing either. I don't know what I was doing, but The Crown was a popular TV show. It was, a Patriots game was going against the Eagles. A lot was going on, but who cares, right? But the reason why November 17, 2019 was important was that's thought to be the first time a human being actually got infected with SARS-CoV-2. And it really was a little bit different on February 28, 2020 for me. So February 28, 2020 was a Friday night. Little known to me, it was National Chocolate Souffle Day, which, by the way, I am amazed that I live in a country that celebrates National Chocolate Souffle Day, and I'm proud of it. So I think that's awesome. But, February 28th, I don't know why you remember anything, but I got a phone call. So that's all that happened was I got a phone call. Dr. Klein said to me, hey, it looks like we have our first positive case of this novel coronavirus, because that's what it was called back then. And she said, a lot of us are getting together at the department tomorrow morning. You want to stop by and see if you can help? I said, well, I got nothing planned. Why not? So that was just the beginning of my little journey in the pandemic. So that's just us telling a story. It's kind of funny. When I got there, I was driving in there about 8:30. I called Gail and said, I don't know if I'm going to be here an hour or longer. I really don't know what they want me to do today. And when I pulled back into my own house that night at 10 o'clock, it was like, wow, what a day. But really, I want to talk about where are we now in the pandemic in Rhode Island. So this was as of June 15th, which isn't too terribly long ago. So a little over 4 million tests. And I know that's kind of an interesting number, over 4 million tests. I remember being at one of the press conferences when Governor Raimondo boldly declared we're going to do 1,000 tests a day. As I was standing behind her, I said, I sure hope we can someday. And I, was amazed that we actually did that. And now we've had weeks where we've done over 150,000 tests a week. There's been over 150,000 positive cases. For those of you who are counting, it's roughly about 15% of the state. And we've had very few cases right now. Right now, we're having very few cases, which is great. The vaccine numbers are at the bottom. I'm actually pretty happy with the Rhode Island vaccine numbers. And I want to make that really clear. I'm really happy with the Rhode Island vaccine numbers. I think that's really important. Some of the states we have in the United States don't have what we have, which is a pretty vaccine receptive community. So I think it's important to get that out open, is that Rhode Island as a whole generally welcomes science and vaccines. So that's a plus for us. But right now we have very few people in the hospital. But one of the concepts I want to get across is that cases, admissions, hospitalization, and deaths, it's all decreasing, but it's not an accident. It was very purposeful. A lot of people had a lot to do with it going down. I would say that 1.1 million people in this state had a lot to do with that going down, because like it or not, everyone's got a role in COVID control. One of the stories about the pandemic that I just like to share with you, though, is the pandemic hasn't affected everyone the same. if there's one thing about this pandemic, it's really been a profound magnifying glass for so much, personally, professionally, but even to our population. But when you really look at the cases we've seen in our state by race and ethnicity, you really see that it's been disproportionately affecting people in the Hispanic and Latinx population. It's also disproportionately affected people who are Black or African American. And these are just important concepts to have in our back of mind. But from the beginning of the pandemic, through the middle of the pandemic, to the peak of the pandemic, to even where we are today, these patterns have held true throughout the entire pandemic. It's just important to have that as a concept in the background, that the pandemic affects people disproportionately for a host of different reasons. Some of it is social determinants of health. And when I talk about social determinants of health, what I'm really talking about is things like there's certain things in life that give you an advantage, and there's certain things in life that give you a disadvantage. One example is where you go to school. If you go to a school that has smaller classes, has a teacher, you have an advantage. If you go to a school that has larger classes and a different teacher every day, that's a disadvantage. If you have access to healthcare, that's an advantage. If you don't have access to healthcare, that's a disadvantage. And part of why I illustrate that is there's various things that are just going to create certain advantages for someone to have a healthier life, and other things going to make people have a disadvantage. One of the things that we saw during the pandemic is the digital divide really was a social determinant of health. It was a digital divide. But one of the things we saw during early vaccine rollout, when the demand was literally ferocious, not everybody had access to a computer. And if you don't have access to a computer, you had access to a phone, but it was harder to refresh on a phone to fight for an appointment slot. And that's one of the things we didn't know, but we actually could see that there were certain neighborhoods in the state that were mostly accessing our website for vaccine reservation through cellular data, not through computer data. And it really became apparent to us, like, we have to do something to actually change that. But those changing social determinants of health are hard and take a long time. So I do want to give at least some acknowledgement to 2020 being the year of isolation. Quite frankly, this is a very important thing for us to understand, is that we have all gone through a population trauma. All of our employees have gone through population trauma. All of our families have gone through a population trauma, and we're still going through it. One of the things that I just think is important to understand is, as a culture, I think one of the things we learned for the first time in 2020 was simply being around anyone else presented a threat. And that's a very different concept than anything we've ever talked about in our country before. In other words, simply being in the presence of someone else was actually decided that that was a threat. And because that's out there as a new concept, we wore masks. We stayed 6 feet apart. Those are public health measures that made sense to prevent disease. But one of the things that's important is we have to acknowledge that there is a trauma that occurred from just, quite frankly, all the isolation that occurred. I think a lot of us understand the isolation personally because we went through it, but we know a lot of people who it affected disproportionately. So there's a reason why, as we come out of the pandemic, the behavioral health population is getting bigger and bigger. There's more psychiatric disease. There's more problems that are part of it. So this is just part of recovery, which we're about to enter in our pandemic, is trying to do that recovery of our pandemic. I have to talk about one of the existential threats to the pandemic right now, though, which is variance. And in the beginning, it was really an alphabet soup of what we talked about with variance. And I was just emailing some colleagues yesterday. I said, my guess is the general public is not just more than a little bit confused about variance. So it's one of those things that I think we just need to do a better job of explaining. But quite frankly, the original form of SARS-CoV-2, which is severe acute respiratory syndrome, coronavirus number 2, is called the wild type. And that's just a term that's used throughout medicine for a long time. So the wild type was what we dealt with in the beginning. We're not dealing with that now. We're dealing with different mutations. Not every mutation makes a variant that matters. Some of the variants of concern were called B17, P1, B34. So now they changed the name from the World Health Organization to alpha, beta, gamma, epsilon. These are called variants of concern. In case you're interested, there's already names for all the way through lambda of variants of interest. Variants of concern are variants that are more transmissible and may cause more severe disease. The most interesting new variant is the Delta variant, which is now, we've had about 3 cases in Rhode Island, but the Delta variant is a rising threat in Rhode Island because it's more contagious and causes more severe disease. It is still covered by the vaccine and still covered by the treatment, the Regeneron monoclonal antibody. And I do want to just touch on this. Like, one of the things about this pandemic, which has occurred, we're 15 months into this, but now it's a treatable disease. It's a preventable disease. The Regeneron monoclonal antibody is still effective. The Lilly one isn't, so we're not using it anymore. But there are places throughout the state, including AtMed, which does it 7 days a week, that will infuse as intravenous infusion. So if someone's diagnosed with COVID now, it's a treatable disease. They should get treated. And in the restrictions on who's treated have largely been lifted. So generally anyone who wants to be treated, who physician thinks indicated, can be treated now. The vaccines, the 3 vaccines are not a secret. You know, the Pfizer and Moderna are 2 doses separated by 3 or 4 weeks. The Pfizer is 12 and older, Moderna 18 and older. Johnson & Johnson had the warning added April 23rd about the very, very rare risk of a blood clot forming, about 1 in 500,000 people. But that was an example of, I think, of a very robust monitoring system that detected that. I don't know about Novavax. It's felt it's going to come out this summer. I think its market's largely going to be overseas because I don't think there's going to be a lot of demand for it in the United States because you already have 3 vaccines. But AstraZeneca, I don't see that coming to market in the United States. I see it more as an overseas product because I don't think our country is going to bother. I don't think they're going to submit for approval in the United States because of the blood clot problem they have. And so I just feel like they don't think it's worth the hassle in the United States. And quite frankly, we have 3 really good vaccines. So I don't think it's going to be anything there's much demand for. You know, I wanted to talk a little bit about, I think, one of the core issues for our time together. There was, why do people decline vaccine? And a little bit of a notion on herd immunity. So, you know, there's a lot of reasons why people decline a vaccine. It might be that it's not FDA approved. They may not believe the disease is that severe. Some people just have a fairly large amount of mistrust, period, at the end. Some people, quite frankly, just don't want to. There's others who've had the disease and feel like, I have the disease, I'm going to go with my natural immunity. Others, access is still a problem. There's some other barriers too, but I think the high risk situation is when susceptible individuals are congregated together. So susceptible individuals are people who have not had the vaccine or not had the disease to a lesser extent. People who've had the disease have limited protection, but keep in mind, coronaviruses do not normally give us long-term immunity. In other words, we've always dealt with coronaviruses. You might remember at the beginning of the pandemic, coronaviruses caused the common cold. But, you know, quite frankly, it's just one of the common cold viruses, but we don't get long-term immunity from common cold viruses. So we don't believe you're going to have long-term immunity from natural infection. We feel like you might have immunity for a few months to a year or so. And after that, we think people are more likely to be reinfected. Whereas with the vaccine, it's thought that there's going to be much more long-term immunity. And herd immunity, you know, kind of the point with herd immunity is you don't want to have susceptible people congregate together. Because if you put unvaccinated people together, what you're really doing is putting all the high-risk people in the same spot. What herd immunity means is either through vaccination or to some degree natural infection, there's most of the people are already immune. And then when I think a simple way to think about what a vaccine does, and this is a really simple way, but think about a steamroller and think about a steamroller on a road and a little Lego, like a little Lego toy that you would play with. If a steamroller sees a Lego, it crushes the Lego. I know all of a sudden I got violent this morning, like, oh my gosh, what is it with this guy? Steamrollers crushing Legos. But what analogy I'm trying to underscore is when your body's immune system, once you've been vaccinated, sees SARS-CoV-2, it crushes it right away, much like a steamroller would crush a Lego, because your immune system is now prepared and it works. So it handles it. Because keep in mind, when you get introduced to a virus, usually it's not a big dose, it's a small amount. So, you know, just a little exposure like that, your immune system, now that it's vaccinated, should deal with it right away. Misinformation has been a problem, not a shock here, but a problem. One of them is, you know, would the vaccine give you COVID? Well, it can't. There's no live virus in it. Could it change your DNA? And no, it can't, because messenger RNA vaccines don't get into the nucleus. It just can't. And the infertility one's been a bit of a mystery. Like how it gets started is hard to understand, but that really, it can't happen. But that took a lot of traction. It still has a fair amount of traction, I think, because it's such an emotional issue. But obviously it can't cause infertility. As I'm closing up here, there's been a lot of positives from the pandemic. I think Zoom that we're on this morning is one of them. I think getting our groceries picked up is pretty kind of fun too. I think the vaccines have been developed, the monoclonal antibodies have been developed. There've really been quite a bit of positives as well from that. Science has moved rapidly in 2020. And I think that's really been a fun thing. I think the big population trauma, though, we still have to process is just this real awareness that being next to each other presented risk. Now, that was always true. But this is the year the country and the planet learned that, because we always were susceptible to disease from each other people, but now we know that, which is part of what the whole population trauma is about. We have to process that and deal with that. So I do want to answer questions because I want to give you a few minutes of chatting here. So let me stop screen sharing so we can look at what's in the chat. Thank you.
Great. Thank you so much, Dr. McDonald. That really was great to get that, foundational and like real-time update. I'd never heard that phrase, population trauma. That makes a lot of sense. I would say, the biggest question that I've received in the chat is, how long is the vaccine good for? Your thoughts on the need for boosters on the vaccine?
I don't know if we're going to need boosters. There's money being committed and research towards boosters. It's not like the flu vaccine. Like the flu vaccine, the reason you get a booster every year is because the flu vaccine has some antigenic drift and changes every year. I don't think SARS-CoV-2 is going to change that much. This is part of why we do keep track of the variants. Like one of the things we're looking for, I've talked about variants of concern. Variants of concern mean we have variants, but they're still covered by the virus, by the vaccine. They might be more transmissible and cause more severe disease, but they're still covered by the vaccine. A variant of high consequence would be a new variant that more transmissible, more severe disease, and not protected by the vaccine or the monoclonal antibody. So we don't have any variants of high consequence in the United States. Where we're most at risk for that, though, is globally. Keep in mind, a little over 2.5 billion people have been vaccinated so far, but there's about 8 billion on the planet. So we really need to vaccinate the whole planet. This really gets to be a larger issue, which is part of why, politics aside, for whatever your politics could be, it's really important that wealthier countries like the United States actually take a really proactive interest in making sure countries that aren't as wealthy get vaccinated, because the global risk, and I just got to make sure you understand this, the global risk is what got us into this problem in the first place, right? In other words, this thing started far, far away, but it's the global risk that we worry about.
Okay, thank you. Any treatments on the horizon for long haulers?
Yeah, so long haulers is an active area of research. Dr. Jennifer Johnson over at the Rhode Island Hospital in Lifespan actually does a fair amount of research on it locally. Right now, it's mostly symptomatic treatment. There isn't a lot of science to offer anything particular that's going to solve that. So, but it's about 10% of people who get COVID have that. And what long hauler means is you're sicker longer than you were supposed to be, longer than 10 days. Usually it's longer than 4 weeks. So it's a really important area.
Yeah, absolutely. What are your thoughts on the prediction for a potential resurgence, especially as we, emerge out of the summer, getting into the colder months?
Yeah, that's really up to us, quite frankly.
Yeah.
Here's the variable. As we get more and more people vaccinated, that becomes a lower and lower risk. Though what you worry about is if there's a new variant of high consequence, that puts us at risk for resurgence. Rhode Island's well positioned. We are in a much better shape than other states in the United States are. So I'm not super worried about it here because I think the vaccine uptake has been robust. I think anything people can do to encourage vaccine uptake is great. Do it gently, kindly though. No one likes to be yelled at or argued with. So, part of what I'm saying is, or shamed. And part of what I'm getting at is I'm accepting people with their questions. When I'm in my office seeing patients, I look my patients in the eye and say, I recommend you get the vaccine. If they say I'm not ready for it yet, I ask if there's any questions. I respectfully answer them. And then I leave them be. I certainly don't get into an argument with my patients because you know what I've learned over the years? It just doesn't work. And it's just important to treat people at their own place, give them the time they need to make their own decision.
Yeah, meet people where they are. That makes a lot of sense. Here's another question about, those who've been vaccinated and then subsequently test positive. The numbers are really low, but do we know how many of these recent positive cases have been from people that have been vaccinated?
So right now, the vaccine breakthrough rate is 0.15%. Okay. Another way of looking at that is 99.85% of the people who've gotten the vaccine haven't had any disease. So it's a very small number. So right now, the real world efficacy is working very well. It's felt that that globally, the vaccine's about 90% effective at preventing symptoms, higher at preventing hospitalization or death.
Okay, great. Your suggestions for employers to assist employees with this, population trauma. I mean, I know it's a big question, but your thoughts and perspective on that?
Yeah, I think one, acknowledge people have gone through a very stressful time. Two, employer flexibility to the extent you can offer it is helpful. Three,
Mhm.
understanding your employees are probably going to be a little bit more short-tempered, and they don't know why, because we've all gone through this population trauma. And I think four, just acknowledging to all the employees that people are valued, you appreciate what they do. I think if there's one thing we learned during this pandemic was how interdependent we are. My goodness, folks, we couldn't get toilet paper. That was shocking to us. Interestingly enough, the illicit drug trade didn't miss a beat because they have a much different infrastructure than the toilet paper delivery system. But I really think it underscores that if there's one thing we've all learned is like everybody who's part of our organization is really critically important. And so I think making sure people feel legitimately valued, and I don't mean an email that says you're wonderful. I mean, once in a while, walking up to someone face to face saying, gosh, I really appreciate what you're doing in my organization. And when you actually can personally connect with your employees and show them they care, it diffuses an enormous lot of stress, and giving people the need to be themselves there, also very helpful as well.
Great, absolutely, the human element. The last question is, and this is really getting back to sort of the theme of the challenge, could you speak to the impact on employers of COVID and specifically chronic diseases?
Yeah, I think really one of the things we have to just accept is that chronic disease drives a lot of healthcare in the United States. The majority of healthcare is driven by chronic disease. One of the concepts we're bringing back to us is as we work on recovering, if we could pick one thing to work on, I'd pick on obesity. Whoops, there we go. Why? Because obesity is often an underlying driver of every chronic disease, and that has a lot to do with our lifestyle. Part of why I get that out there is we look at what was one of the risk factors people with COVID ended up in the hospital it was obesity. Well, you live in a country where 2 out of 3 adults are either overweight or obese. So I'm in that group, all right? I'm working on that myself. It's a long journey and it's a courageous journey, but I think things we do that promote health are good, but things that if you focus it on something like, I want my workers to be less obese. I didn't say make them feel less happy, work on their nutrition, work on their ability to exercise, things we can do. I think that's the way to advance public health. And it really addresses not just COVID, but every other chronic disease.
Yep. Okay. Terrific. Well, thank you very much for joining us this morning. And I would like to, let's see, I'm looking at my reactions. I can't do a virtual round of applause, but thank you very much, Dr.
Thank you, guys. It was fun meeting with you guys. Have a good rest of your Thursday.
We appreciate
Bye-bye.
you joining us this morning very much.
Sure.
So again, thank you to Dr. McDonald for sharing the latest insight vaccine rollout and the essential role that employers play in educating employees, encouraging them to be vaccinated, continuing to ensure a safe and healthy workplace as many employees return, at least on a part-time basis, to their office environments. So now we will be moving into our first breakout session where you'll be split up into 2 breakout rooms. Members of the Rhode Island Business Group on Health and Productivity Committee will act as facilitators in each room, helping to lead the interactive discussion on the employer's role with vaccines and ongoing health and safety practices as offices look to reopen. This is really your opportunity to share your experiences and learn from others as we all collectively are focused on emerging from this pandemic. The breakout session will run for 20 minutes. Once you're in the session, your facilitator will introduce themselves and get the discussion going. You'll receive a 5-minute notice and then a 60-second countdown at the end of the 20 minutes before you will be returned to the main session. I hope you all enjoy connecting with one another. Off we go. So I hope that you enjoyed the opportunity to connect with some other RIBGH members and others to learn about how we're all, responding to how we've responded to the pandemic and practices and encouraging employees to get vaccinated, impacts to wellness programming. So I know we've talked about this concept of population trauma. I know one thing in reflection with the pandemic is it's really important to feel part of the community and that sense of belonging. So I hope that you enjoyed that opportunity, and we'll look forward to the next breakout as well. I'll now turn the program over to Al Charbonneau, RIBGH's Executive Director, to present the Crush COVID Employer Challenge Award winners.
Great, thank you, Kate. The Crush COVID Challenge was designed to help workplaces curb the spread of COVID-19 and to reduce its health impact through the promotion of and adherence to prevention measures and chronic disease management. As you know, the challenge is sponsored by the Rhode Island Business Group on Health, the Rhode Island Department of Health, and the Rhode Island Foundation. Participating employers were awarded points for engaging in specific prevention activities such as encouraging employee vaccinations, promoting employee adherence to COVID-19 social distancing in the workplace and at home, encouraging employees to get a flu shot, and encouraging the use of choosing wisely materials to limit low-value care that is not only wasteful, but often causes health difficulties. Employers that submitted an application were given access to an online toolkit containing links to information and materials that help them facilitate participation in the challenge. The RIBGH Crush COVID Employer Challenge Committee, that's a mouthful, selected the winners based on the combination of the greatest number of compulsory points earned, most creative employee engagement strategies, and creative, safe workplaces. We are now delighted to announce the following winners of the Crush COVID Challenge. They all, by the way, will receive this framed, I'm fumbling here, this framed certificate. I won't do my impersonations of a drum roll, so we're just going to virtually accede to this. But in the small employer category, that is 2 to 99 employees, the committee selected Wood River Health Services because they embraced the Crush COVID Challenge by actively engaging, educating, and inspiring the staff to help reduce the impact of COVID-19 in the workplace. Using resources provided by the Rhode Island Department of Health, Choosing Wisely, and the CDC, Wood River Health Services created a supportive environment for important workplace health and safety and supported staff vaccinations. By using pre-established communication platforms through their wellness committee, employees were kept updated and inspired to use the numerous resources available for the workplace and home. Stephanie Callender, HR Director for Wood River Health Services, is here to accept the award on their behalf. Congratulations to Wood River Health Services, the winner of the Crush COVID Challenge in the small employee category. Just going to do a little round of applause and move on. In the mid-employer size, that is 100 to 249 employees, Delta Dental of Rhode Island crushed COVID in a big way. The most innovative idea submitted from all companies participating in the challenge, Delta Dental, you can see that for a moment, created a digital punch card for employees to fill out by completing wellness activities and fighting against COVID. Wellness prizes were raffled in a live Zoom call. Delta Dental also actively supported total workforce well-being by distributing Rhode Island Department of Health diabetes and chronic disease prevention and management program materials to employees, offering virtual health webinars and webinar/wellness events through the Community Health Network, Choosing Wisely, and their vendor partners, and promoting the RIDOH Walk with Ease program. Delta made resources and care available and accessible to employees by promoting the Crush COVID RI app, informing employees of the RIDOH walk-up testing options, and sharing resources debunking common COVID myths to employees. Kristen Mizozo, and my apologies, it took me years to learn how to pronounce Charbonneau, Director of Human Resources for Delta Dental, is here to accept the award on their behalf. Congratulations to Delta Dental for crushing COVID. A round of applause. The large employer category was a challenge to the committee, and they finally decided to select two large employers for this challenge, two winners, because of both maximized their scores and submitted extra credit. This is the 250 plus employee category. The first is Teknor Apex, supported both remote and on-site workforces during the pandemic, requiring significant policy and environmental updates, including specific protocols for drivers who are exposed to additional risks. Innovative workplaces included color coding teams to limit exposure and quarantines, and a comprehensive 83-question daily audit ensuring all departments and locations were compliant. A multimedia communications approach educated and trained all employees on COVID protocols and precautions, while fee-free PPE, cleaning supplies, and on-site COVID testing and vaccine clinics improved access to resources. Mark Piemonte, plant manager, and Justin Jolliffe, EHS manager for Teknor Apex, are here to accept the award. Congratulations to Teknor Apex for doing a great job supporting their employees during the pandemic and making employee safety their #1 priority as employees return to work. Round of applause. And finally, Blue Cross and Blue Shield of Rhode Island actively promoted the Crush COVID Challenge and Choosing Wisely resources to their employees. They also will get a suitably framed certificate for this award. Their employees, most of their who work mostly remote since March 2020, 30% of whom are now converted to full-time teleworkers. In addition to rolling out comprehensive communication campaign featuring content for senior workers and state officials, they established a Future of Work Council that meets on a weekly basis to discuss all things COVID-19, including updated CDC guidance, COVID-19 policies and procedures, upcoming communications regarding COVID-19 remote/hybrid work environments, required technology, and much more. Future of Work surveys were conducted twice to determine the ideal future of work what the ideal future of work at Blue Cross looks like to each individual and how well associates felt that they were being supported. Erin Schillick, Senior HR Business Partner for Blue Cross and Blue Shield of Rhode Island, is here to accept the award on their behalf. Congratulations to Blue Cross and Blue Shield for caring about your employees and providing the resources they need to navigate much better. And congratulations on that Future of Work activity. I think that's extremely important. Well, congratulations to all winners for their hard work in curbing the spread of COVID-19 in their workplaces and continuing to encourage prevention and wellness to their employees. I'll now turn the program back to Kate, who will lead us to our second breakout session. Thank you.
Thanks, Al. Congratulations to our award winners and to all of the employers that participated in the challenge. We understand how the role of HR and health and safety professionals and plant managers were impacted with the pandemic. Many days it felt as if you were working 2 or 3 or more jobs at a time. So let's just give one final round of applause to all of the award winners. So we'd now like to move into our second breakout room, where we'll have the Crush COVID Challenge award winners share information on their practices and successes. We'll divide up into two rooms, one with the small and mid-sized winners and one with the 2 large group winners. This is another interactive session led by other facilitators from the Health and Productivity Committee. They'll ask you to introduce yourselves when you when you have a question or begin to speak. But we hope that you learn some more best practices and get to share a few yourself. This breakout room will run for 20 minutes again. And so with that, let's transition to those breakout rooms. Welcome back to the general session. I'd like to thank everyone for joining us this morning. I hope that you gained some valuable, timely information from Dr. McDonald. And I hope that you enjoyed hearing from and learning from your peers and our challenge winners in our breakout sessions. Congratulations again to our challenge winners. And I hope that you all have a happy and healthy day.